Good afternoon, everyone. My name is Alana Tievsky, and I'm pleased to welcome you to our SBIRT Google Hangout entitled Taking a Step Towards Integrated Care. I'm going to be serving as your moderator today, and I'm really excited to have all of you here. This is actually the first Google Hangout that I've done, and so I'm glad you can be a part of it. So, quick housekeeping item. If you have any questions, you should type them into the question box, which is on the bottom right-hand corner of your screen. And we're going to save the last 10 or so minutes for questions. We'll get to as many as we can. And for the questions we don't get to, we'll be sure to email you responses to those. So without further ado, I want to introduce our two wonderful panelists today. We have Pam Pietruszewski, who's an integrated healthcare consultant on the National Council's Consulting and Policy and Practice Improvement team. We also have Jake Bowling. Jake is the Director of Practice Improvement on the Policy and Practice Improvement team. And today they're going to be talking to us about, really helping us answer the question of why SBIRT? Why is it so critical to be implementing this at your organization, and how this can help us build integrated systems of care? And then finally, how the National Council can support you in integrating SBIRT into your clinical practice. So with that, I'll turn things over to Pam and Jake.
Thank you so much, Alana, and we're excited to be on this Google Hangout with you all today. I think that this is also, I know this is my first Google Hangout, and I think that it's also Pam's, so thank you for bearing with us as we use this new technology. And thank you for your interest in SBIRT as a topic in a way to improve overall clinical care for the people that we serve. So I'm going to be sharing a little bit of information about what SBIRT is and why it's useful for behavioral health and in integrated care settings. So just a little bit of background about me. I work as a Director of Practice Improvement here at the National Council, where I'm the project director for the Reducing Adolescent Substance Abuse Initiative. And this initiative is a Hilton Foundation funded learning community where we're training 27 community behavioral health organizations on how to integrate SBIRT into their routine care for adolescents. In addition, I work for the Samsa Hirsa Center for Integrated Health Solutions, and we're doing some work also related to SBIRT and trying to increase the adoption of SBIRT in the field. And then Pam and I will be talking a little bit later about what we do in our consulting department related to SBIRT. So I know that prior to coming to the National Council as a social worker, a lot of the work that we do is downstream work. A lot of the work we do is supporting people once they've already been diagnosed with a substance use disorder, and that's extremely important work. But SBIRT gives us the opportunity to move a little bit further upstream and to change our lens from just supporting folks who have substance use disorders to helping people identify the unhealthy ways that they use substances earlier to intervene earlier, and to use the skills that we have as clinicians and staff to help negotiate a safer use and reduce their risk to prevent the progression toward a substance use disorder. And so it's really exciting to me that SBIRT is a way for us as a field to really move upstream and to engage in more prevention and early intervention work. So I wanted to share, and that's especially important because for people with mental health conditions, we know that they're disproportionately impacted by substance use disorders. And that goes for both adults and adolescents. So it means that we need more tools to help prevent people from developing substance use disorders and to help intervene earlier so that they don't have to experience the devastating impact of substance use disorders. In addition, SBIRT is a way to also identify people with substance use disorders, but that's a very small part of the SBIRT protocol. So let me actually tell you what SBIRT is. SBIRT, S-B-I-R-T, is a three-part clinical protocol: screening, brief intervention, and referral to treatment. So the screening involves using a valid screening instrument that's shown to be sensitive to substance use. It's usually very short, maybe 6 questions where you're asking people about their substance use patterns. Then that screening tool generates a score. And based on the score that a person gets, you'll either provide a brief intervention, which is a 5 to 10 minute, really potent motivational interviewing session where you talk to them about their use and help them come up with some solutions, help promote some health behavior change, and then help them develop a plan. Or if the score is high enough, you'll provide a brief intervention and refer them for further assessment and specialty addiction treatment. So the protocol is really great because it gives clinicians the tools to use these scores to generate an appropriate clinical response to what you've identified during the screening process. And so the way that this has been implemented in our learning community has been really it really varies from site to site. Some folks have embedded screening in their intake processes. Some have embedded in outpatient therapy sessions. So they're really trying to fit SBIRT, and really, since SBIRT has 3 different parts to it, fit the components of SBIRT within their existing clinical protocols in a way that makes sense for their particular organization. So I would posit that there's a few reasons that SBIRT is really important. On the clinical level, we know that we can't get very far with people around their mental health or around their whole health without addressing substance use. To give you kind of an example of that, I recently had a family member who likes to go down into his man cave, watch the game, and have a few beers. Unfortunately, when he has to go to the restroom, he has to climb the stairs and come back down. And on his way back down, he stumbled down the steps and broke his leg. He broke his leg because he was a little tipsy. Now, he probably wouldn't meet the threshold for a substance use disorder, but if he had health professionals that were asking him about his use, they may be able to uncover that he's drinking in unhealthy ways and have some conversations about him that would impact his whole health. And we know that there are many other comorbidities associated with alcohol and drug use. You all are well aware of those, but it is important that we have the tools to be able to have those really important conversations in all healthcare contexts. On an organizational level, SBIRT can also be really important. SBIRT kind of fortifies your organization as an organization that cares about prevention and early intervention, which in the evolving healthcare landscape will continue to be a really important capacity of any organization. If your organization is interested in building co-occurring capability, so learning how to do co-occurring work, SBIRT is a great first step to begin to learn about substance use disorders, to begin to identify folks, to begin to build referral networks and partnerships. SBIRT can be a great step in that direction. And then also SBIRT really positions your organization for partnerships. In our learning community, we've seen organizations who've learned how to do SBIRT within the walls of their mental health center, but then they've taken it out and said, let's go to a school and do this. Let's go to the FQHC in our neighborhood and do this. Let's think about let's think about other systems that people with a risk for substance use disorders interface with. And let's take this to the streets and use this as a new business opportunity for us. And so we've found that it both makes sense kind of on a clinical level because it improves overall clinical care, and on an organizational level because it can position you for new partnerships and build the kind of capabilities that are really important in the evolving healthcare landscape. So with that, I will kind of hand it over to Pam to talk a little bit more about what this actually looks like.
Great, thank you, Jake. That was a great introduction. Yeah, Jake and I have been working quite a bit lately with the Reducing Adolescent Substance Use Initiative. And to tell you a little bit about myself, prior to coming to the National Council, I had worked on a 4-state SBIRT implementation project. So it was SBIRT for substance use, along with depression collaborative care. And we did this in Minnesota, Wisconsin, Pennsylvania, and Massachusetts. And we learned a great deal in that case, about adults and how to implement SBIRT, as Jake said, upstream in a prevention and early intervention type work prior to somebody getting or having a substance use disorder. And we did that in the primary care setting, where a lot of people are showing up and being seen, of course, for a lot of different healthcare concerns. And I think it's really important to think about how SBIRT fits into a person's overall health. If someone is drinking more than the recommended levels and they're also on a blood pressure medication, what kind of conversation can we be having about that? If someone's being treated for depression or anxiety and they're also using marijuana, how can we add that to the conversation and make that a very opportunistic moment where we can educate people and help identify how they can reduce their risk? So after that, coming to the National Council now, Jake and I are working with this adolescent population across, I think it's 8 states. Is that right, Jake?
It's 6.
6. Oh, where was I going with that? 6 different states, and learning quite a bit now about how to do this with adolescents. There isn't as much research around this work with adolescents, but it's definitely growing, and hopefully we're contributing to the improvement findings as we do this work. What Jake and I thought we would do is take a moment to show you a piece of SBIRT, the piece that I think is the critical glue for making this really fit and really work. So you've got the screening, and you've got on the other end referral to treatment. In the middle is the brief intervention. So anybody who scores positive on the particular screening test that you use can benefit from a brief intervention, at least one time to sit and talk with a provider or some other caregiver about their use, to reflect on their motivations for use, their interest in reducing their use, and then, if needed, referring them on to treatment. So we're going to just take a moment and just give you a feel for what the brief intervention could look like. So as Jake said, again, it's 5, 10, maybe 15 minutes. We don't have the time to do all of that today, but we'll give you a feel of what one could start looking like. So if Jake comes into my clinic and I have a positive screening test result from him, I may start by saying, "Hi, Jake, I'm wondering, could you tell me a little bit about alcohol and how it fits into your life?"
It's not a big deal. I just like to go out with friends every now and again and let loose a little.
It feels good to unwind.
Yes, I have a very, very stressful job, so it feels good to unwind.
Okay. Tell me, have there been any downsides to your drinking? Things that are not so good about it?
I mean, not really, but just, occasionally I'll have a hangover or something, and when I have to work the next day, that can be a little bit of a downside, I would say.
Okay, so on the one hand, drinking is a way to unwind, relax a little bit. You've got a very stressful job, be with your friends. On the other hand, it's hard to do your job when you're feeling hungover. Where does that leave you?
Well, I guess if it's a work night, I could stick to a couple of drinks or something like that.
So you've thought of some ways to reduce any of the negative effects of alcohol, potentially reducing how much you drink during the week.
Yeah, I think that could probably work.
That sounds like a good plan. Okay, so obviously that was something we were able to do in a pretty quick amount of time. What we would do in a typical session is really spend some time exploring that, exploring some options that the client comes up with or the patient identifies as possible ways to reduce their use. We might also give them some feedback, some information about healthy limits, what some of the national recommendations are around how much use is considered within the lower risk categories. We have a conversation that involves a lot of motivational interviewing, if you may have noticed, and we try to meet the client where they're at. If they're not ready to make any kind of change, we want to affirm that they've been willing to come in and share with us their use. If they are thinking about making a change, we don't push too hard, but we certainly go with that and explore with them what they might be willing to do. And it's a real, as we were saying before, it's a real upstream process. This isn't about identifying people that need substance use specialty treatment, although we will uncover some of that as well. It's really about early intervention. Yes, please, go ahead.
So Pam, yeah, I was just going to ask if our viewers want more information or training on this, what are opportunities that they can participate in?
Oh, great. We'd love to say more about that. Jake, do you want to start and then I'll jump in?
Yeah, so one thing that we can provide is we could do a 90-minute kind of overview that will really give you the full context of SBIRT. Kind of before we dive into the clinical training and building your clinical skill around SBIRT, just to help you learn how to talk about it with your staff, learn how to talk about it with your leadership, learn how to gain buy-in and understanding about what SBIRT is and how it could look within your organization.
Yeah, we've really learned that it's important to have the system support, the leadership support, and the understanding of why this is something that could fit for your organization. So we want to be able to offer that kind of initial, it's not so much a training, although there are elements that we will sprinkle in there to give you a flavor for what the training looks like. But it's really to help you have the buy-in and the foundation in order to do this well. Additionally, what we can do is we do a full day training, an actual on-site training. We have a lot of fun with this. We come in and we engage people around why should we be also putting in our realm of quote-unquote expertise something having to do with substance use. For a lot of mental health providers, for physical health providers, that isn't necessarily something they're used to addressing. So we give people some of those basic tools to understand why and how to bring up this topic. Then we go into having people really practice how to do the screening in a way that's very fluid, very natural, comfortable, how to build rapport with a client or a patient when you're now going to start asking them about something they aren't used to you asking them. And then how to effectively transition into a brief intervention. We spend the bulk of our time really on how to beef up, enhance your motivational interviewing skills, and how to do the elements of a brief intervention that can bring about the best results. We also sprinkle in some things about referral to treatment, have you think about what is your local environment like, what are the expectations when it comes to referring or helping somebody get connected to the right treatment provider. And we do a lot of practice and we show a lot of videos because it really is about hands-on trying it in a safe environment with your peers so that you feel really comfortable when you go out and start doing this with clients and patients. And then from there, you really can learn a lot from the clients as you start doing it. The third piece that we also provide, if people are interested, is what we call Fidelity Coaching, or online or some kind of virtual connectivity with you, perhaps once a month for 3 to 6 months, so that you have staff that go out and try some of these things and come back usually with more questions once they've gotten their feet wet. And so we do some coaching around how to do a really good quality brief intervention. Things that people get tripped up on when it comes to screening. Or maybe there's something in the system or the leadership is having doubts or additional concerns or questions about how to make this fit within your current workflow and the way you deliver your services. We have that other end for other support opportunities as well.
Great, thanks. So we've saved the last 10 minutes for questions from the audience, although I'm not seeing any, so I want to encourage everyone, don't be shy. That's what we're here for. And until we get some questions, I actually have a few. So the first I want to ask is, change is hard. I hear it from our members all the time, whether, they're billing a new third-party payer or introducing a new clinical protocol or SBIRT or motivational interviewing. So what are some tips that you can give our attendees on, working through this change and getting their colleagues on board?
Pam, I'd be glad to start, and if you want to add anything on. I think there are three things that kind of immediately come to mind. One is that you have to make the case for why SBIRT is important among the staff who are going to be implementing it. And it's not hard to make the case, necessarily, because SBIRT does improve clinical care. But you have to say that and demonstrate that and talk about that and really be a champion for it. Also, I think the second thing is making sure that the right people are at the table. So have a core team of individuals with your organization that are going to be involved in this initiative that includes clinical staff, your CEO, possibly your CFO or billing person, because there are some financing levers that are becoming available for SBIRT. Your IT staff, if you're hoping to use your electronic health record for clinical decision support around SBIRT. So you're really going to want to make sure that all the right people are at the table. And then finally, I would say identify champions on all levels for SBIRT within your organization, because it takes some, SBIRT is important, but it's not easy. That's why the one and done training model just doesn't really work with SBIRT. It takes fidelity work and ongoing support. And so you have to have champions, have the dogged persistence to keep this thing going in the midst of other competing demands, which I think everyone's worked in a clinical setting and knows that there's a million things going on at once, a million change initiatives, and that could be really, really tough. But I think having a champion who knows how to talk about why this is important and knows how to link people with the kind of support they need to feel really comfortable and emboldened to do this is really critical.
And this is why I love when Jake and I do trainings together, because Jake speaks so much and so authentically to the implementation experience and the importance of the stakeholders to have that same mission or vision. And where my mind goes when I think of change is all of those elements around motivational interviewing and the importance of using what they call the MI spirit. So even with our own colleagues or other leaders or stakeholders, appreciating and understanding and eliciting from them what is their motivation for wanting or not wanting to do SBIRT, to make a change in this area. Appreciating that it is a partnership and that there are other competing demands, and really being curious and drawing out from them what concerns do you have, what would be the good things about having a program like this in place.
Great, thank you. We have a really great question from Jana Pruitt. She asked, what is the general attitude of primary care providers towards using SBIRT? And is this a billable service for Medicaid plans or commercial insurance companies?
Great. I'll start with the primary care question, because most of my project work had been with primary care. I have found that when they understand and really can appreciate how the use of substances can impact a person's physical health, they see it as a no-brainer that this should be part of the conversation. Counseling, brief screening, and intervention for alcohol use in adults is actually ranked really high on the U.S. Preventive Services Task Force list of different preventive services that primary care should deliver. What is often the case, though, is that a primary care physician cannot add this to their plate. They've got a lot of things they're trying to do. A lot of primary care clinics are working toward or doing team-based care, where they've got other members of their team who have the time and often have really great skills in building that rapport with a patient and talking more about reasons for improving their health behaviors, including reducing substance use. And it's part of that whole picture of physical activity and healthy nutrition and improving our mood and decreasing or reducing our risk for substance use.
And I would be glad to add the piece or the question around the Medicaid billing and health plan billing. So there are codes in about half of the states in the U.S. for screening and brief intervention. Now, as you know, with any Medicaid service, there has to be alignment between the service, the setting where it's approved to be offered, and the person who's going to be providing the service. So there's a lot of nuances and complexity state by state based on whether those three things are aligned or not, but there are opportunities to use SBI codes for Medicaid in many states. So what I would recommend is to either reach out to us after the Google Hangout, and we'd be glad to help you explore your own state-specific financing landscape for SBIRT, or ARETA, IRETA. They have an awesome map of the U.S. where you can click on the map and look at all the billing codes in Medicaid and Medicare for that specific state related to SBIRT, and perhaps Alana can send that out to all the participants who registered for this, so you could really dig a little deeper about the state-specific landscape. But there are opportunities to receive reimbursement through Medicaid and through private health plans.
Great, thank you. Looks like we've got time for one more question, and if no one else has any, I've got one. Just wait a couple more seconds. All right. So I know, Jake, earlier you referenced how SBIRT can be a great opportunity to create partnerships across different parts of healthcare, schools. And so what are some tips you have in starting to create those partnerships and using SBIRT as your kind of bargaining chip to create the conversation?
Yeah, I mean, I think the first thing to remember is we, as behavioral health professionals, healthcare professionals, there are a lot of transferable skills that fit really neatly into SBIRT, including the ability to know how to do motivational interviewing, which is such a foundational part of SBIRT. Also, we have to know how to talk about it in a way that will get the buy-in of wherever we're going. So we have to be able to make the case that by us providing this service to them, it will improve the lives, the care of the people who they're serving, and that we are the ones that are uniquely positioned to provide that particular service. So those would be the two major kind of messaging points that I would carry into that conversation. I think that what a lot of our providers are finding is that it's not a super difficult sell to make because they are offering to really do the work. And also they're offering to be a referral site. So when people need specialty substance use treatment, they're saying we can also help you support those individuals as well. So it's a real value add in addition to being able to engage in an SBIRT partnership.
And I would add to Jana's question about, the general attitude of primary care. So what Jake said is right on, that, I think mental health providers, behavioral health providers have an opportunity to be part of that conversation and to say, I've got good motivational interviewing skills. I know how to develop rapport and to elicit motivation from my clients. How could I do this in an SBIRT setting, whether it's in primary care, in the schools, in the criminal justice system, in my own mental health clinic? It's really a win-win, and it really can help us better link all of those pieces, substance use and diet and nutrition, exercise, mood, physical health conditions. It's all health. I think SBIRT's a good piece of that.
And I'm sorry to add on just one more piece, that as the healthcare landscape changes and we're paying more for value than we are for the number and volume of services, there will be more, especially primary care entities, that are interested in finding ways to help people be healthier and help prevent illness. So I think that this is also, the new healthcare landscape is an opportunity to really make that case as well.
Great. Well, thanks, everyone. We just got a quick question about that this Google Hangout was going to introduce a new consulting line And so those were the 3 items that Jake and Pam had referenced earlier. So we have 90-minute calls to really introduce you to SBIRT and go through the components of it. We have a day-long training where we fly out to you and deep dive into the clinical components of SBIRT and how to get your team on board. And then we have Fidelity Coaching, which we recommend 1 hour a month for 3 to 6 months. But again, this is really for your needs, and so we're happy to customize a package that works for you. So that's the short of it. I will also send and follow up to this email the IRETA, IRETA website, along with the one-pagers that we have that detail the full consulting line. But it is 3:01, and I don't want to take up any more of your time, so thank you so much for joining us. Also, in follow-up to this Hangout, we'll be having I'll send out a brief survey, if you wouldn't mind filling that out so we can continue to improve on the products and webinars and Hangouts that we provide to you all. And thanks so much for joining us.
Thanks, everybody.
You folks, take care.
Bye.
Bye.